Hi, today we are presenting on the aging process. I'm Brenna.
And I'm Sarah Polson. To start off with, we're going to talk about the population. We found this quote and it says, "The aging process happens during an individual's lifespan. We are all involved in this process and none can escape it. Aging begins with birth and goes through childhood, accelerates through the maturing years, and is most evident during our senior years and ends in death." So the aging individual of today, in the 1900s, the life expectancy was only 47 years, but today children can expect to live well into their 80s and even beyond that. And this increase in age is due to better healthcare, sanitation, and medical treatment advancements. So factors that influence the quality of our aging process include heredity, gender. They say that women are more likely to age or live longer than men. The ethnicity is also a factor, lifestyle, education, medical care, and our economic level in society. Physical changes that occur with aging mostly occur in our appearances, which include the wearing down of our teeth, our gray hair, wrinkles, sagging eyelids, and then I will go into detail on these next few in the next slides. So changes in the senses are mainly in vision and hearing. So visual is difficulty shifting from far to near objects, difficulty focusing on close objects, and for hearing, there's a decrease in the ability to hear high-pitched sounds. Taste, smell, and touch, and the ability to perceive and interpret painful stimuli also declines. Then there are also changes within these systems. The musculoskeletal changes include diminished height, a forward lean, reduction in muscle mass, and joint stiffening. And cardiovascular and respiratory system changes. The lungs lose their elasticity, and increased energy is necessary to sustain breathing. The amount of oxygen reaching the lungs also decreases, causing the heart to pump less blood, and there's also an increase in blood pressure. Psychological changes. There is a decrease in physical health and social and economic resources, an increased vulnerability to loneliness, and there is increased embarrassment due to the fact that people who age can't do things as well as they once were able to. Intellectual changes, so fluid intelligence or the ability to formulate new memory, short-term memory, and the ability to hold and process information decreases. Declarative memory, so names, events, places, declines, but non-declarative memory, which is procedures, that remains the same. Sociological changes are influenced by an individual's attitudes, role, expectation, income, and relationships. And it is likely that the baby boomers are likely to remain in the workforce today longer due to economic problems and decreased retirement savings. The functioning characteristics of the aging population include slow decision making, decreased reaction time, stiffening of the joints, auditory and visual decreases, increased blood pressure, bowel incontinence, concern for health and finances, and worry over accessibility. The purpose of TR is to promote functional independence, optimize health and well-being, and to promote better life satisfaction. TRs help the aging adult learn adaptation, which is compensating for losses while retaining the potential for growth. We help them with leisure activities, which provide opportunities for social support. We also teach them leisure education, which empowers them and helps them to make decisions. We also do physical activities with them to promote functional independence, stimulate the mind, and lower blood pressure. Different settings that we can help the aging population is through private clubs, recreation centers, adult daycare, outdoor recreation. We can help them in their homes and also in planned retirement communities. And these are a few interventions of therapeutic recreation. A few are that we need to speak in lower tones, we need to provide goal-oriented experiences, plan rest intervals, and activities should allow for various energy and skill levels. We should include volunteer and service projects. And we should also remember the physical environment in which our programs are located.
Okay, so now we're going to talk a little bit about the aging population and disabilities and illnesses that they face. The older population, especially over age 65, often suffers from cognitive, physical, sensory, communication, and social impairments and addictions. And this is a list of some of the most common examples. And we're going to go into depth on a few of these. So dementia will be the first one, and a definition of it, according to the Alzheimer's Association, is dementia is not a specific disease. It is an overall term that describes a wide range of symptoms associated with the decline in memory and other thinking skills, severe enough to reduce a person's ability to perform everyday activities. There are two common types of dementia. The first is vascular dementia. It accounts for about 30% of the population. It's more common in males than females. It has an earlier onset than dementia and Alzheimer's disease, which is the one we'll get to in just a second. And it's usually accompanied by cerebrovascular disease. Okay, and then Alzheimer's disease is a progressive, irreversible neurological disorder that results in complete loss of cognitive functioning, followed by loss of all physical abilities. It accounts for about 50% of the population, and as we age, it's more likely to occur. And then there's early and late onset of the types. I made a list of some of like the kind of general stages of Alzheimer's disease. So for earlier symptoms, it usually looks like the normal aging process at first, but then it slowly gets a little more advanced. And it's characterized by general confusion, recent memories are lost, personality changes, and depression. And then some of the later symptoms further into the disease are skilled and purposeful movements disintegrate, sleep is disrupted, hallucinations, ability to speak is lost, and inability to recognize familiar objects and people. And this includes family members and people they've known all their lives. And it's also important to remember that these symptoms differ from person to person. Some of them may not even happen, or they're in a different order, things like that. Something interesting with Alzheimer's and Down syndrome, they're both genetic mutations of the 21st chromosome. And this results in a high probability that someone with Down syndrome will develop Alzheimer's in their life. The diagnosis and treatments. Alzheimer's disease cannot be confirmed until after death with a brain autopsy. So while they're living, They usually just look at the symptoms and they make a really good guess, essentially, that they have Alzheimer's disease. And then once they're dead, they can actually go in and tell that they did indeed have it, and that's what ultimately killed them. There are medications to treat the symptoms of Alzheimer's, but there's no actual cure as of now. And then the survival age ranges from 3 to 10 years. Dementia causes memory impairments in at least one of these areas: aphasia, apraxia, agnosia, and executive functioning. And it can also be found in any of these other diseases as another part of it. Okay, and then another disability that comes with the aging process are emotional impairments and addictions. So for emotional impairments, they include issues that include sadness, anxiety, pessimism, lack of interest, lack of appetite, things like that. And then for depression, it's usually diagnosed at an older age, and it's attributed to severe stress due to increase in loss or loss of family members and friends, diagnosis of illnesses, things like that. And it can be controlled by medications and interventions. Also, another thing to note, the suicide rates actually increase with older age. For addictions, these can be adult onset, meaning that they were recently developed in their old age, or they could be lifelong addictions. And these are difficult to detect due to higher pain tolerance that they develop and typically less interaction with others as they age. Alcohol is the most common. Then there's over-the-counter drugs and prescribed medications. Signs of drug use include depression, pain disorders, defensiveness, change in social behavior, more accidents, changes in sleep patterns. Anxiety, insomnia, dementia are associated with an alcohol addiction as well. And then another disability for old age is developmental disabilities. These people experience similar health problems as other aging people. Early onset of aging occurs in Down syndrome and cerebral palsy. These people typically need help understanding and adjusting to changes that come with the aging process. They have a strong dependence on family members and staff, which can often lead to depression and behavioral changes that result when they are moved to a care facility after a primary caregiver or their parents pass away or are no longer able to care for them. Down syndrome, like I mentioned before, has a higher risk of getting Alzheimer's disease and getting it earlier in their life. They also have higher rates of sensory loss, diabetes, and strokes, and an intensification of pre-existing conditions. Some additional considerations to note: there are secondary concerns that come with these other disabilities as we age. So these things are contractures, pressure sores, pneumonia, dehydration, malnutrition, obesity, and increased fall risk. Okay, now for the purpose of TR, when working with disabilities in the elderly, is to promote health, choices, and independence. They also want to prevent impairments, maintain optimal physical and cognitive functioning, help provide access to health information, social support and services for the elderly, and preservation of self-esteem. For people with Down syndrome, TR is used as a developmental tool and as a way to maintain friendships and inclusion options, health maintenance, and understanding and adjusting to the aging process. And then depression usually goes undiagnosed, and these are some reasons why. They associate symptoms with other physical illnesses. They're less likely to feel depressed. They are less likely to say they are feeling depressed, and symptoms are perceived as or are the same as parts